Can you see my screen?
Yes, now we can see it and we can hear you properly, so you're very welcome to start.
Okay. Good morning. I would like to thank the organizing committee of this event for the opportunity to be here with you today. My name is Valéria Panhoni, and I'm from the University of São Paulo, Brazil. And I brought an experience report on a sexual abuse involving children, adolescents, and early pregnancy. So I know that I have 15 to 20 minutes, so I will score the most relevant milestones in the survey. And I hope to be as clear as possible to collaborate with some way with this Congress. Violence pervades the lives of many people around the world and touch all of us in some way. To many people, staying out of harm's way is a matter of locking doors and windows and avoiding dangerous places. To others, escape is not possible. The threat of violence is behind those doors while hiding from the public view. Who spoke those words was Gru Harlem Brundtland, Director General World Health Organization in the year 2003. Sexual violence in childhood and adolescence has become a priority in the health segment, present in different spaces of society, even within the family. Extra-family rape is regarded as the sexual violence performed by someone unknown or not close to the family. Intra-family or incestual rape is the sexual violence occurred within the family environment, include close relatives and those with affective bonds, such as parent, stepfather, uncle, brother, brother-in-law, brothers, and cousin.
I'm sorry for interrupting, but we still viewing only the first slide. So
I'm sorry. I'm sorry. I don't know what's going on. Let me see. Now change. Is changing or not?
Not quite changing.
Oh my God, what's going on? Let's see. Now change. Not yet.
Not yet, really not yet.
Oh,
why don't you try clicking on slide 2, if you wouldn't mind trying that. Go ahead and click on slide 2.
Okay. Now?
No, but to the left where you have the slides numbered, 1, 2, 3, go ahead and click your cursor on slide 2 on the left hand. There you go.
Like it did. Okay,
yes,
thank you so much. Okay, violence pervades the lives of many people around the world and touch all of us in some way. To many people, staying out of harm's way is a matter of locking doors and windows and avoid dangerous places. To others, escape is not possible. The threat of violence is behind those doors while hiding for the public view. Who spoke those words was Gru Harlem Brundtland, Director General, World Health Organization, in the year 2003. Sexual violence in childhood and adolescence has become a priority in the health segment, present in different spaces of society, even within the family. Extra-family rape is regarded as the sexual violence performed by someone unknown or not close to the family. Intra-family or incestuous rape is the sexual violence occurred within the family environment, include close relatives and those with affective bonds such as parent, stepfather, uncle, brother, brother-in-law, and cousin, among others. Among the damages of sexual abuse, pregnancy stands out due to the complexity of its outcomes. The undesired pregnancy under these circumstances has influence in the legal legislation of each country, with different laws allowing the abortion or not. The Brazilian norms to attend to pregnancy cases resulting from rape establish that the healthcare units should provide 3 definitive options. The first one, to maintain gestation till the end and include the newborn in the family. Number 2, to maintain gestation till the end and deliver the newborn for adoption. The third one, to require abortion under the law. The objective of this study is to compare the options chosen depending on the type of rape, either extra or intra-family, and improve knowledge about the sexually abused children and adolescents' condition. This descriptive and comparative transversal study was conducted using an electronic database that included patients attending at Pérola Byton Hospital. The sample was selected on the basis of convenience sample and selected according to the inclusion criteria, patients with allegation of pregnancy resulting from violence. This study included 531 children and adolescents between 10 and 18 years old, between 1994 and 2014, when it started the health service. And 2 groups of sexual abuse were compared: extra-family, intra-family. This study evaluated 531 children and adolescents experienced rape and pregnancy, with 401 cases, 75.5% were from extra-family, and 130 cases, 24.5%, from the intra-family or incest. The abused human's age varied between 10 and 18 years old, averaging 15.4 plus or minus 2.0 years, and the children and adolescents experience extra-family sexual violence. The abused human's age varied between 10 and 18 years old, averaging 14.2 plus or minus 1.6 years in the intra-family group. In the extra-family group, the author of the violence was indicated as unknown in 216 cases, 53.9%, and a community resident in 133 cases, 33.2%, and sexual partner in 45 cases, 11.2%, and co-worker in 7 cases, 1.7%. In the intra-family sexual violence group, the author was indicated as the stepfather in 40 cases, 30.8%, biological father in 28 cases, 21.5%, uncle in 21 cases, 16.2%, brother in 20 cases, 15.4%, cousin in 12 cases, 9.2%, and brother-in-law in 9 cases, 6.9%. The table of sexual violence against children and adolescents identified for each group are shown here in the table 1. Understood the vulnerability condition of children under the age of 14 years old, not associated with physical strength or threat, show to be the most frequent type of rape of vulnerable person in the intra-family sexual abuse group. In 78.2%, you can see on the table 1, pointing out that the offender has other resources to perform such abuse under this vulnerability condition. The offender takes advantage of this position as adult before the child's minor psychosocial development, mainly members of the family, thus configuring themselves in incestuous relationship. Although including different factors, the incest causes several damages to the health, cognitive, and the emotional development. Success in preventing child abuse can lead to the reductions in the prevalence of post-traumatic disorders and unplanned pregnancy. The characteristic of gestational age in the 2 groups evaluated, as well as the outcome of pregnancy, are described here in the table 2. No approval of abortion due to the gestational age over 22 weeks or the estimate of fetal age over 500 grams were significantly more frequent in the intra-family sexual violence, 18.6%, when compared with the extra-family group, 40.2%. In these cases, the gestational age and fetal weight limits to perform the legal abortion were exclusively technical, based on the World Health Organization. It is necessary to be aware of the care of the prevention of the child abuse relationships, especially within the family itself. Incest involves the whole family and is guaranteed as a secret, as well as its frequency in the family dynamics. Therefore, the incestuous relationship lasts for a long time as marital relationship between those involved, showing the change of roles within the family group. The option and autonomy of choice for abortion provided by law among pregnancy children and adolescents as a result of sexual violence is that in the two groups studied was reviewed with a difference in outcomes. The reasons preventing the legal abortion were different in two groups. In the extra-family group, the legal reasons for abortion provided by law, as well as its interpretation, remain. In the intra-family, the health reasons were decisive. In the intra-family pregnancy cases resulting from sexual abuse, it were noted indicators suggesting that the child and the adolescent's vulnerability and their close relationship with the author imply in the late arrival at the healthcare unit, thus negatively interfering in the assistance to the legal abortion allowed by the Brazilian legislation. That's it, more than 22 weeks of gestation. This is my reference. And I brought a message of William James. The greatest discovery of our generation is that human beings can change their life by altering their attitude of mind. If you don't change, you'll never fly. Thank you very much.